Outrage explodes in Nanyuki. Today we go deep inside the controversial deal to build a 50-bed Ebola quarantine facility at the Laikipia Air Base.
When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years. The American government has supported us. They have deployed
Two people were shot dead on Monday in Nanyuki during demonstrations against the proposed Ebola quarantine facility at the Laikipia Air Base. 3 others sustained serious injuries, including 2 who suffered gunshot wounds, while another was allegedly struck with a baton by a police officer in an incident captured on camera. As grieving families demand justice, local residents and leaders continue to oppose plans for the controversial facility.
Tear gas in Nanyuki, running battles in the streets, and a secret multi-million-dollar international deal frozen by the High Court. On Monday, June the 1st, 2026, the citizens of Laikipia said no. Why is the United States building an Ebola quarantine centre on Kenyan soil? Welcome back to News Mummy Kenya. This is part 2.
On Ebola, if Kenya does end up blocking the U.S. quarantine facility there, and it seems like they might since the Kenyan courts are delaying it, where will Americans who have been exposed end up going? And then why can't they just come to the United States? I mean, I think you would probably agree that the U.S. has pretty good health care here. So where will they go, and why not to the U.S.?
Jennifer, the main issue with having a facility close to the Democratic Republic of the Congo is if a patient is sick. Again, I'll speak as a heart doctor. I want to take the patient to the OR that's right next door to the room they're sick in, not to the building next to them, or to 3 buildings 2 blocks away. We are confident, and the State Department's working on this diligently, that they're going to be able to work out something with Kenya. There has already been a fair amount of communication around this issue. We have and that's by the way, there's a UK base there. We have other people who might be willing to welcome us, and we have our German colleagues as well. So there's many places we can send folks, but sending them across the world, especially when we're not sure what's going on with them, is probably not the wisest move.
The regional threat is real. A public health emergency of international concern has been declared over a rare variant of Ebola, the Bundibugyo strain, surging through the DRC and Uganda. While the Ministry of Health has scaled up border surveillance, a massive storm was quietly brewing behind closed doors. A $13.5 million deal to build a 50-bed quarantine facility at Laikipia Air Base. According to High Court petitions filed by the Law Society of Kenya and Katiba Institute, the plan was simple, yet terrifying to locals. American citizens exposed to Ebola in the region would be flown directly to Nanyuki for quarantine. If they developed symptoms, they'd head to Europe. The government defends it as global health responsibility, but the public sees a threat to sovereignty and safety.
As I talk to the country this evening, we are screening every day any visitor who comes to Kenya. All our borders are on high alert. All our borders, land borders, air borders, are already activated. There is surveillance, there is screening. On average, we screen close to 3,000 people every day who either come to Kenya or are in transit, to make sure that those who show symptoms, we quarantine them, we isolate them, test them. Fortunately for our country, not a single person tested has tested positive for Ebola. And I want to ask leaders and citizens who have any doubt on the level of preparedness by the government of Kenya, that they should not have any such doubt. Our partnership with our friends, the American government, is a partnership that is mutually beneficial to us and to them. When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay, because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years. The American government has supported us. They have deployed huge resources in Kenya to work with us on HIV/AIDS, to work with us on other diseases. They worked with us on Ebola. In fact, KEMRI was one of the institutions that worked on research on the vaccines for COVID, because we have a solid partnership with America and other partners. So the facility that is at Laikipia Air Base is not a facility different from all the other facilities that we have across Kenya. We have 23 other facilities set up in Kenyatta Hospital, in the police hospital in Nairobi, in Moi Teaching and Referral Hospital in Eldoret, in Kenyatta Hospital in Thika, in Alupe Hospital in Busia, and in many other areas. And these facilities are meant to make sure that there is proper screening, and if there is any positive identification of people who have Ebola, then immediately they are isolated, they are treated, so that we avoid any spread of the disease.
Turning now to Ebola in Africa. The Trump administration confirms it is working to set up a quarantine facility in Kenya. White House officials told reporters today it will be open tomorrow. It will be open only for Americans who were exposed to or infected with the deadly illness. At least 223 people are believed to have died from Ebola in the Democratic Republic of Congo. That number, of course, is expected to grow. I want to bring in CBS News medical correspondent Dr. Celine Gounder. As you know, and we discuss this every time, she's an infectious disease specialist who spent time in Guinea as an Ebola aid worker during the West African pandemic. Dr. Gounder, help my audience understand what you make of and what those in this space perceive about either the benefits or the risks of putting a facility in Kenya and not bringing any American who's suspected of being infected home for treatment here.
So this facility in Kenya will have treatment, monoclonal antibodies, which may or may not work against this variant, this species of Ebola, antivirals, respiratory support. But medevac planes can actually deliver all of that in the air. what the planes cannot do, so dialysis, mechanical ventilation, heart-lung bypass machines, the quarantine unit in Kenya will not be able to do either. On the other hand, American biocontainment units at places like Emory, Nebraska, Bellevue, and other facilities across the country, they can provide that higher level of care. So the administration is essentially sending Americans who get infected with Ebola to a middle tier of care when they could go straight to the best back home. And they're also saying that if Americans need a higher level of care, they will be sent to facilities in Europe. They haven't yet identified what those facilities would be. And the plan is already facing resistance on the ground, not just from aid workers and specialists like myself who are concerned that this will discourage people from going over to assist, but also on the ground, Kenya's doctors union is threatening a nationwide strike, and you have a legal challenge that has been filed in Kenya's highest court.
The US strategy has long focused on footprint isolation, contain the threat regionally, far from the American homeland, and Kenya became the chosen strategic hub. But local leaders, including Laikipia Governor Joshua Irungu, strongly disagree, stating it exposes workers inside the airbase directly to a virus with no approved cure.
As a governor of Laikipia County, kwa sababu ya yale mambo uamuzi ule umefanywa ya kwamba Ebola quarantine iweze kufanywa katika kaunti ya Laikipia, na nataka kuchukua hii nafasi kwa sababu tangu ile hayo mambo yamekuweko, tumeweza kuongea pamoja na viongozi, tumefanya utafiti wetu na tukasema ya kwamba hapa katika Laikipia tumekataa, hatutaki hiyo maneno. I know the health is a devolved function, na kwa hivyo hata igawa kungehitajika quarantine ya katika ya watu wetu wa Laikipia County, sisi tulikuwa tumejipanga hayo mambo yakitokea. Lakini kwa wakati huu hakuna Ebola signs hata any signs au symptoms katika Laikipia County, na kwa hivyo tumekataa na tumekubaliana kama viongozi na kama wakaaji wa Laikipia County, hatutaki quarantine hiyo imependekezwa ati itaanzishwa katika Laikipia County, kwa sababu hiyo ni kutahadisha, it is to expose our people of Laikipia kwa mambo ya Ebola which is not there, so inakuja kuwa introduce katika Laikipia County. Sisi na kule inafaa inasemekana itawekwa, tuko na uhusiano ni ya kwamba kuna watu wetu wanaingia kule wanafanya biashara na nyuki, na kwa hivyo hii is a very bad virus, na kwa hivyo hatugetaka hata kidogo on behalf of the great people of Laikipia County. Na kwa hivyo nataka kuchukua hii nafasi kwa watu wetu wa Nanyuki na kwa watu wetu wa Laikipia County kusema ya kwamba we will go any length, na kwa hivyo tusikue na wasiwasi kwa haijaanzwa, lakini tumekataa na tutafanya whatever need to be done to make sure that it doesn't start in quarantine ya Ebola katika Laikipia County. Na kwa hivyo tutulie wakati huu kwa sababu hakuna kitu imefanywa, tukue na amani kwa sababu tutaenda hata tuongee na serikali kuu na tuone ya kwamba hakuna quarantine ya Ebola katika Laikipia County.
On Monday, the youth of Nanyuki took to the streets for a different fight. Despite Justice Patricia Nanyuki issuing an emergency court order temporarily halting the facility, the residents demanded total cancellation. They refused to let their town become a quarantine outpost for foreign nationals. Sovereignty versus global obligation. Public safety versus international funding. The High Court case returns to the spotlight, and NMK will be there. What do you think? Is Kenya right to hold the line for global health, or are we being played? Drop your comments below. Don't forget to like, share, and hit that subscribe button. This is News Mummy Kenya, keeping it unfiltered.
Acho wanamita mjalo wananyuki asla. Tunatafutia watoto tunalelea hapa. Tuko na uchungu sana.
Munashindwa na shaa. Munashindwa na vitu midogo kama kolera. Munashindwa na linda mama. Munashindwa na kolera. Munashindwa na watoto waliochomeka pale udumizi. Ebola ndo utaweza. Inakaa kama zizi la ng'ombe. Ebola ndo utaweza. Kama Ebola ni mzuri, wewe William Ruto, President, wewe William Ruto, kama Ebola ni mzuri,
Ibaki US.
waite luncheon. Ukiwaita luncheon, waende wakunywe chai State House.
These people, they do not want to account for any American who is sick within their soil, but they want to dump sick Americans in the Republic of Kenya. The Minister for Defense have said nothing. The Minister for Health, we have seen him boasting in some local media stations, saying that that quarantine center is for both Americans and Kenyans. Now my question is one, why is it that SHA is not working? Our young children who are going to hospital, they cannot even access vaccines. We are buying vaccines. Basic things like dealing with diabetes and hypertension, we cannot afford, we cannot get drugs, but Kenyan government is readily and willing to receive 1.7 billion at the expense of the millions of Kenyans who live with us. And therefore we want to say the president has let us down. The concerned minister should resign, Eden Duale. The concerned Minister for Defense should resign because they don't serve Americans. It is Kenyans who pay taxpayers. If our money is not enough to cater for you, Donald Trump money will only help you to bury us. But because God is living, I pray that the first casualties who should deal with Ebola after Muzungu, let it be State House and the associates of William Ruto.
That the best way of containment of any outbreak is through the epicenter, the point of outbreak, like in Congo. We have seen that the spread, the disease has now been spreading on a very high rate in Congo, particularly because of the war that is ongoing in that particular country. And as such, we asked our government and also the regional governments that there should be more force, more resources and more experts that are sent to Congo to help the containment. Because we know very well, and this is the reality, that the moment we have a reported case in the country, the moment we have an outbreak in the country, things changes.